You're listening to Health Professional Radio with Wayne Bucklar. Today my guest in studio is Lisa Capamagian from Tunstall Health. Lisa, welcome to Health Professional Radio, and I think I got the name wrong. It's Tunstall Healthcare, isn't it?
Yes, it is. And thanks for having me on.
My pleasure. Now, Lisa, tell us about Tunstall Healthcare. First of all, what geographic range in the world do you sit?
Well, we're actually a global company. Our head office is based in the UK in a lovely old mansion in North Yorkshire, of all places. And we have our head office for Asia Pacific here in Australia, in Brisbane, which is lovely and sunny today. And we cover Australia nationally from Brisbane.
Well, fortunately, we'll be heard in the UK and the US and Canada, so we'll see if we can give the head office a bit of a fright. They'll be going, oh, goodness, what's happening in Australia?
Lots.
So, Lisa, tell us about your product range. What is it that Tunstall Healthcare provides?
Okay, so we provide a range of telehealth care equipment. So things like medical alarms that perhaps older people will wear a little button around their neck and they can press that and get assistance. We provide monitoring systems, 24-hour response services, telehealth equipment, monitoring systems, and also triage services.
Now, when you say triage services, triage in my mind is something that happens in emergency rooms.
Yeah.
How are you using the word?
So in terms of remote monitoring of people using vital sign monitoring equipment and answering health interviews, and we have nurses who review that incoming data. They will determine the level of risk for the individual. They'll phone them or video conference with them, and they'll provide a triage according to Standard 9, like you would in a hospital, and determine what the risk is for the individual and if they need to go to the hospital or go and see their doctor within a period of time.
Wow, I had no idea that level of acute care was being done remotely.
Well, we probably refer to it as more subacute care rather than acute care. But, right. We can do that, and we've had wonderful success at doing that.
So, Lisa, most of our audience are clinicians, doctors and nurses and allied health professionals working in hospitals.
Yeah.
What is it that you'd like them to know about your products and services?
Well, I think one of the things that we'd like to clear up is a misnomer about what telehealth is, because a lot of people see telehealth as just video conferencing from, say, a remote clinic to a specialist in a hospital or something like that. Whereas our type of telehealth system is really about providing support for people in their homes. So we can actually monitor people in their own homes who have complex and chronic conditions. And that includes monitoring their vital signs, having them conduct health interviews, so they're answering symptomatic questions, as well as being able to, talk to them over the phone or provide a video conferencing. So we'd just like to provide a little bit more education to people that telehealth is a lot more than just video conferencing.
Because you extend to trips and falls monitoring and kind of what was conventionally done only by an in-house carer, don't you?
Oh, yeah, we certainly do. Through our Telecare system, we can monitor falls, and that means we can get to people very quickly to support them so that they're not lying, in their own home for extended periods of time with a broken hip and exacerbating their condition. So that's one of the benefits of the types of systems we have.
And Lisa, is there a special requirement for, high-speed broadband or satellite links or anything for this, or is it just a telephone service? What does it need to make it work?
Well, on the Telecare side of things, so supporting a medical alarm, they're available in GSM, so 3G connections, as well as using the plain old telephone line. And with telehealth, if you're going down the video conferencing line, if you have NBN broadband, well, that will give you fantastic video conferencing, obviously. But we were able to provide quality video conferencing over 4G, 3G, and also ADSL connections. Doesn't work very well on satellite, but we can certainly do all the vital sign and health interviews via data connection on satellite, but unfortunately it's not quite good enough to do a video conference yet, Wayne.
It does sound, though, like technology and connectivity is not a big impediment to what you're doing. Sounds like pretty much everyone with, average connectivity in Australia could use the service.
Yeah, pretty much. I don't think we've found anyone yet that we haven't been able to monitor somehow with some form of equipment that we have.
You're listening to Health Professional Radio with Wayne Bucklar, and I've been talking to Lisa Capamagian, who is the Corporate Development Manager with Tunstall Healthcare, and we've been talking about the services that are available. I guess, in my mind, I would describe them to allow people to stay in their own homes, even with significant medical issues, for longer, and to be monitored and cared for remotely. Now, Lisa, my favourite question, is there a misconception about your products and services that drives you nuts and keeps you awake at night?
Oh, that's a hard one. Probably the biggest one for us is still re-educating people about telehealth and video conferencing. And I guess the other thing is, in terms of Telecare and medical alarms, that it's only for older people. Really, that kind of product and service can apply to anyone of any age and ability and any circumstance. It's very handy.
Yes, it would be very handy, and in fact, someone I'd consider quite young, given my advancing years, a colleague of mine who's just in their early 40s has recently been diagnosed with epilepsy, and I can see that home monitoring would make their life a lot easier.
Absolutely. In fact, we support a lot of young adults with epilepsy through a nocturnal epilepsy sensor, which measures if they have a tonic-clonic seizure while they're in bed asleep at night, and that means that they can have appropriate support provided to them. And, of course, the falls detector when they're out and about during the daytime.
Intriguing. Lisa, Tunstall Healthcare's got a long history, hasn't it? It's not a newcomer to this field.
Oh, no. We've been around for about 57 years, and it actually was started by a gentleman called Norman Tunstall, who was an electronics engineer, and he had a little electronics shop, and he used to look after his mum, and she fell over and hurt herself one day, and when he popped in to say hello to her, she'd been lying on the floor all day with an injured hip. So he thought, well, I should be able to invent something so she can let me know if she has any problems. So he invented a simple little buzzer system, and I think he would be very excited to see all the advancements that have taken that simple product from where it was back 57 years ago to where it is today.
Well, after 57 years, and I see on your website being in 50 countries, I'm sure that you've got it down to a fine art by now.
Yeah, we're pretty good at it by now. That's for sure.
Lisa, it's been a pleasure having you on Health Professional Radio with me today. If you've just tuned in and you've missed this conversation with Lisa, you can find a transcript of it on our website and a sound archive as well. The best way to get hold of Tunstall Healthcare is through their website, and I think that's www.tunstall.healthcare.com.au. And is there a phone number that people can ring you on, Lisa?
Oh, there certainly is. So our main number here in Australia is 1-800-603-377. But on our website you will find all our global contacts and our global contact numbers.
So, by all means, if we've intrigued you with what you can do with remote sensing and remote healthcare, give Tunstall Healthcare a ring or check out their website. My name's Wayne Bucklar. This is Health Professional Radio.